Okay, for this project, I created this name that is Hito, creating spaces where everyone feels safe and comfortable. The topic you gave me is creating spaces for adults that are going to receive treatment for cancer in the hospital Hito. So it's to create a space where they feel comfortable. And this because this is a hospital that was created for kids. So the challenge is to try to modify some things so avoiding infantilizing the medical experience they're going to have in the hospital. First, I have the definitions that HITO is the first center in Mexico dedicated to treating cancer for patients from 0 to 18 years old, and it has been considered among the 50 best hospitals worldwide. Okay, and an oncologic hospital is a place where they only focus on giving treatment for cancer, like therapies, chemo, and all the treatments they give to the person that are having the problem. Okay, so with the main idea of the problem, I create my hypothesis that it's that thanks to the fact that the facilities were designed primarily to be used by infants, now the older patients are going to be integrated to this space. They're not going to feel comfortable because they consider this is a children's environment, and they will be probably receiving treatment designed for infants. I don't mean treatment in the way like the medicines and all that. I'm referring to the way they treat them like persons, like they don't want to be treated like children or like little kids. They want to be treated like adults as what they are. So I think that's one of the main topics that I want to talk about in my hypothesis. Okay, the delimitation of the problem and the objectives. I am researching how I can create comfortable spaces for patients and their families because the families are a really important part because are the ones that are with them in all this process. How I can create spaces where they can feel comfortable and have a good experience, and for the ones that are going to visit the hospital but not living aside the kids, also having the idea that there are also kids that need that spaces. So how can create something where everyone feel comfortable? And I have three specific objectives. That the first one is identifying the impact of the environment in the way the patients react to the treatment, triggers that determine patients' comfort, and understand the impact that age has on the way patients experience the treatment. Because it's not the same thing that happens when a kid have it or when an adult is having the treatment. They can take it in different ways. So how we can understand the way they are seeing this process, and it will be important because this can help me to create an space where they can feel okay. The simple delimitation, and I'm going to focus especially on the adults that are going to start using the service and the family members that are going to be with them during all this process. And the main idea is to separate them in age ranges so they can so I can know the different perspective of the people, because it's not the same thing that happens in the mind of someone that has 20 years old or 60 years old or 5 years old. And in this we're talking about that we're going to have patients of all the ages. So it's important to know the different type of the point of views. So I want to focus especially on this and the family members that are going to be with them. For the data collection, I am going to use quantitative and qualitative data. For the quantitative data, I'm going to conduct interviews with adults who have suffered of the disease, diving them into a different age ranges, as I already explained, because it's not the same the way one see the things and the same and the same way other people can see it. So it's important to have different opinions. I will ask different questions such as, for example, what environmental factors can influence your comfort during the treatment? Or do you consider that how the space design is important for the way you are receiving the treatment? Also, spending a day with a patient, it will be really interesting to see the routine. What do they do every day? So I think it's a really important point because you can have like the vision of how it's the day with them and with the family member, because this like a team and they have to work together. So it's important to know what they need and what we can do to help them. And I will also use direct observation methods to analyze. That is it's the one that I already said. And also I'm going to analyze the environment, how it looks, and how are the facilities, and what are the areas of opportunities. The techniques for analyzing and synthesis, I will collect all the surveys and interviews and create graphs, and then I'm going to analyze that graphs to know what information I really have. And for the interviews, I'm going to, and with the experience that I want to have with a patient, I'm going to collect the things that they tell me that are the most important, like some phrases or something, some things that they can tell me that can help me to have another vision. How can I develop the solution? Well, once that I already have all the data and the analysis of the surveys and the observation, I can be able to start having brainstorms until creating an idea that can solve the problem. If it's the one that I have in the hypothesis, or if in the data collection I notice that there's another problem or another thing that I need to focus on, I can apply it here to know I can have the idea. So in the brainstorm, I can have different ideas and create one that can help in all the things that I need to solve. And with this, I can develop a proposal, and once I already have it, I have to take it to the directors of the institution, showing the data and having all the presentation, so I can explain them why my solution will be a good option to implement, and having all the data to tell them that it's important. Okay, in my learning reflection, this was really interesting, and I learned how to create solutions using, well, paying attention to people needs, because it's really important, and I notice it now that I have this course, because it's really interesting how if you focus on people's needs you can create really different things, and it's a really important thing, and it's really interesting because I can solve a problem, but I can also can connect with other people's, and it's awesome because you create those connections. I think I can reinforce in creating the question, because it's a part that it's a little bit confusing, but well, at first it was confusing. Now I have more idea about it, but I think I can work on it, and I think I can use this method in next projects because it's a really interesting, and it could be a really good method for me to work in next projects because it's thanks.